Ever wondered how you would respond if someone around you was experiencing a mental health crisis? It's not a scenario we often prepare for, yet it's becoming increasingly common in today's fast-paced world. Mental health issues are not just a personal struggle. They're a societal challenge that we must all learn to navigate. The importance of mental health awareness cannot be overstated. It's about understanding that mental health is just as important as physical health. It's about acknowledging that everyone at some point in their lives can be affected by mental health issues. Being prepared to provide mental health first aid is crucial. It's like knowing CPR for the mind. It's about being able to step in during a crisis and provide immediate support, comfort, and understanding. Mental health matters. It's a conversation we need to have, and it's a skill we need to learn. It's time we all become equipped with the skills to provide mental health first aid. What does it mean to provide mental health first aid? To answer that, we need to delve into the concept of mental health first aid itself. Just as physical first aid is given to someone suffering from a physical injury, mental health first aid is immediate assistance provided to someone experiencing a mental health crisis. It's a way of supporting someone in their time of need, offering a comforting presence until professional help can be sought. But what does this entail? Initially, it involves recognizing the signs and symptoms of mental health issues. This may include sudden changes in behavior, mood, or appearance. It could be someone expressing feelings of hopelessness, displaying excessive fears or anxieties, or even talking about self-harm. Understanding these signs is the first step in providing mental health first aid. Once these signs are recognized, the next step is offering immediate assistance. This doesn't mean you're expected to provide therapy or solve their problems. Rather, it's about being there for them, lending a listening ear, and providing reassurance. It's about helping them understand they're not alone and their feelings are valid. Finally, guiding the person towards professional help is a crucial part of mental health first aid. This could be encouraging them to see a mental health professional or helping them find resources in their community. It's important to remember that while we can provide immediate support, we're not replacements for professional care. Mental health first aid is about fostering a society that understands mental health issues are as real as physical ones. It's about creating an environment where people feel comfortable seeking help and where we're equipped to provide immediate support when someone is in distress. Just as we learn first aid for physical injuries, we should be prepared to offer immediate help for mental health crises. Because in the end, mental health matters just as much as physical health, and it's high time we start treating it as such. Scene script. Ready to learn how to provide mental health first aid? Let's dive into this step-by-step guide. The first part of the process is recognizing the signs of a mental health issue. This can be a change in behavior, mood, or appearance. It could be someone who is usually outgoing becoming withdrawn, or someone who is typically calm showing signs of anxiety or agitation. It's crucial to remember that everyone's experience with mental health is different, and these signs can manifest in various ways. Next, we approach the person. This can feel daunting, but it's important to approach the situation with kindness and respect. You might say something like, "I've noticed you've been acting differently lately. Is there something you'd like to talk about?" It's vital to give them space to open up, but if they're not ready, respect their decision and let them know you're there for them when they're ready. Listening without judgment is the third step. This might be one of the most challenging parts of the process, but it's also one of the most important. The person you're helping needs to feel heard and understood. As you listen, remember to maintain eye contact, nod occasionally to show you're engaged, and withhold any judgment or advice. This isn't the time to diagnose or suggest solutions, but to provide a safe space for them to express their feelings. Reassuring the person is our fourth step. It's crucial to let them know that it's okay to not be okay and that they're not alone. You might say something like, "It sounds like you're going through a tough time, but please remember that help is available and you don't have to face this alone." Reassurance can provide comfort and hope, and it can make a significant difference in how someone views their situation. Finally, we guide them towards professional help. This could be a mental health professional, a trusted doctor, or a local mental health service. It's important to remember that while you can provide support, you're not a substitute for professional help. Encourage them to seek assistance, and if they're comfortable, help them make the first steps towards getting it. If the situation is serious, don't hesitate to contact a mental health crisis line. Remember, providing mental health first aid isn't about being a hero or fixing someone's problems. It's about being there for someone in need, providing support, and helping guide them towards the help they need. It's about being a friend, a confidant, and a lifeline in a time of need. By following these steps, you can make a significant difference in someone's life. Empathy and understanding play a crucial role in mental health first aid. But how can we best demonstrate these qualities? Let's delve a bit deeper into this. Empathy, at its core, is the ability to understand and share the feelings of another. In the context of mental health first aid, it is about being present, listening, and validating the emotions of the person in distress. It's about acknowledging their pain, not dismissing it or trying to fix it immediately. It's about saying, "I'm here for you," and meaning it. Understanding, on the other hand, is about comprehending the situation from the individual's perspective. It's about recognizing the signs of distress and knowing how to respond. Understanding is crucial because it helps you tailor your approach to the person's needs and situation. Now, let's consider a few ways to demonstrate empathy and understanding effectively. Firstly, listen attentively. Active listening involves giving your full attention, nodding to acknowledge you're following along, and paraphrasing to show you understand what's being shared. Secondly, use supportive language. Avoid judgmental or dismissive comments. Instead, use words that show compassion and respect for the person's feelings and experiences. Thirdly, validate their emotions. You might not fully grasp what they're going through, but you can still validate their feelings. It's about affirming that their emotions are important and real. Lastly, be patient. Understand that recovery doesn't happen overnight. Supporting someone through a mental health crisis is about being there for the long haul, not just the immediate aftermath. In summary, empathy and understanding in mental health first aid are about being present, listening, validating emotions, and showing patience. It's about creating a safe and supportive environment where the individual feels heard, valued, and not alone. Remember, your empathy and understanding can be a beacon of hope for someone in a mental health crisis. As we move forward, let's carry this sentiment with us and continue to explore how we can best support those in need. When should we encourage professional help, and how can we do this without stigmatizing the person? This question lies at the heart of mental health first aid. Encouraging professional help should happen when someone's mental health appears to be causing them distress or impeding their daily life. It's important to remember that this is not about labeling or judging someone, but rather about supporting them in their journey. We can approach this conversation with empathy and respect. First, affirm the person's feelings and experiences. Use phrases like, "I can see you're going through a tough time," or "I'm here for you." This validation can make a world of difference. Next, suggest getting professional help as a form of self-care, not as a last resort. Emphasize that it's okay to seek help, that mental health professionals are equipped with tools and strategies to manage mental health challenges. Encouraging professional help is a crucial step in mental health first aid. Remember, we are not therapists, but we can be bridges to those who are. So, are you ready to make a difference in someone's life? We've covered a lot of ground today, diving into the critical world of mental health first aid. We've learned about its importance, the vital steps involved, recognizing signs, listening empathetically, and offering support. We've also emphasized the significance of encouraging professional help. But this is just the beginning of your journey. Like any other skill, mental health first aid requires practice and continued learning. So keep exploring, keep educating yourself, and most importantly, keep practicing empathy and understanding. You have the potential to be a beacon of hope for someone struggling in the darkness, and that's an incredible power to have. So, what's next? Well, we're here to help you on this journey. Remember, your actions can save a life. Subscribe to our channel for more content on mental health. Together, we can make a difference.